Hi everyone, my name is Cai Pei, and my partner is Liu Jintong. Our presentation's topic is New Treatment and Prevention of Parkinson's Disease, Drugs Targeting Alpha-synuclein. Before the main part, I will read some essential words. Please repeat after me. Rigidity, postural, apathy, inhibitor, receptor. First, let's take a look at some famous people with Parkinson's disease. The man on the left is Deng Xiaoping. We all have seen him in our history textbooks. Then, the second man is Michael Andrew Fox. He is a Canadian-American retired actor. Although the worsening symptoms forced Fox to have a less active career, he continued to make guest appearances on television. Next, the woman on the right is Chen Ya-wen. She is a Taiwanese female singer, and she has been diagnosed with Parkinson's disease recently. Doctors say that she has moderate cerebral atrophy in her left brain. So, what are the causes of illness? The answers are the loss of dopamine and the presence of Lewy bodies. Loss of dopamine brings the loss of neurons in substantia nigra plus compacta. And presence of Lewy bodies means that the protein alpha-synuclein abnormally accumulates in the brain. Next, I will introduce the history of Parkinson's disease. In 1817, the first clinical symptoms of the disease, then called shaking palsy, were broadly described by James Parkinson. Jean Martin Charcot named the disease after Parkinson in 1867. In 1912, abnormal protein aggregates were identified in neurons of people with Parkinson's disease. These aggregates are called Lewy bodies. 1997 marked a major milestone in the knowledge and understanding of Parkinson's disease, with the discovery that Lewy bodies are in part made of a protein called alpha-synuclein. Then, from this chart of the age distribution, we can know that 71 to 80 years old account for the largest proportion. Besides, many studies have shown that men are more likely to have Parkinson's than women. Next, I will talk about the risk factors of this disease. One is genetics, the other is environmental factors. Genetics cause about 10 to 15% of all Parkinson's. Over the years, scientists have studied DNA from people with Parkinson's disease. They discovered dozens of gene mutations linked to Parkinson's disease. Environmental risk factors associated with Parkinson's disease include head injury, area of residence, exposure to pesticides, and more. Proceeding on, let's focus on the symptoms of Parkinson's disease. The main motor symptoms include tremor, rigidity, slow movement, and postural instability. These are caused by substantia nigra plus compacta. And when Lewy bodies spread to further regions of the brain, non-motor symptoms are also produced, such as apathy, memory loss, insomnia, and anosmia, the inability to smell. Next, my partner Eric will continue this presentation.
Thanks, my partner Trivago. Now I'm going to talk about the common treatment of Parkinson's disease. First, I want to introduce one of the common treatment medications. Since most symptoms of Parkinson's disease are caused by a lack of dopamine in the brain, many Parkinson's disease drugs are aimed at either temporarily replenishing dopamine or mimicking the action of dopamine. This type of drugs are called dopaminergic medications that generally help reduce muscle rigidity, improve speed and coordination of movement, and lessen tremor, such as levodopa, COMT inhibitors, MAO-B inhibitors, dopamine agonists. Second, I'll introduce the other common treatment, surgery. Surgical method may relieve symptoms of Parkinson's disease in some people. Surgical procedures for Parkinson's disease are typically considered after the other treatment, like medicine, have been exhausted. Additionally, surgical procedures for people with Parkinson's disease aim to destroy specific parts of the brain to relieve symptoms. These procedures include polyzotomy, thalamotomy, and subthalamotomy. However, these procedures have major risks, including the possibility of death. Today, deep brain stimulation, DBS, is the most common surgery for Parkinson's disease. DBS has fewer risks and works by disrupting electrical signal in the brain rather than destroying tissues. After the efforts of scientists, they published a new breakthrough treatment which called targeting alpha-synuclein. Let me simply introduce alpha-synuclein. Alpha-synuclein is a neuronal protein that regulates synaptic vesicle trafficking and subsequent neurotransmitter release. It is abundant in the brain, while smaller amounts are found in the heart, muscle, and other tissues. So, you may wonder, how can we apply this new method? Alpha-synuclein has many biophysical characteristics. It renders the nerve cells resistant to viral infection and propagation. It commonly produced in the enteric nervous system (ESM), and then traffics to the central nervous system (CNS) brain. So, overproduction of alpha-synuclein in the ENS and its chronic trafficking to the CNS may damage nerves and lead of Parkinson's disease. So our goal is targeting the formation of alpha-synuclein aggregates in the ENS and therefore slow the progression of the disease. We targeting alpha-synuclein to interference the spread of alpha-synuclein, reduce a synuclein's production, and inhibition of alpha-synuclein aggregation and aggregate reduction. The last topic of my part is prevention. The research indicates that caffeine, cigarette, exercise, and antioxidant. This method can reduce the risk of getting Parkinson's disease. That brings me in the end of my presentation. Thanks for your attention. This is our reference. Question 1. Which one is the symptom of Parkinson's disease? Tremor. Question 2. What are the 2 risk factors of Parkinson's disease? Genetics and environmental factors. Question 3. How to prevent Parkinson's disease? Exercise, caffeine, smoking cigarettes, and antioxidants.